is. I know what a systematic review is, but how do I bridge the gap where research is no longer me being published in a peer-reviewed journal, but me actually seeing visibly the insights that I've called out from this research to be something that I can see visibly? Is that question that our speaker today is going to answer. We have with us Dr. Oluwadamilare Akingbade from the School of Nursing, Dalhousie University, Canada. He's a certified global nurse consultant, community health nursing specialist, and educator whose work focuses on advancing health equity through digital health, artificial intelligence, and community-engaged nursing research. He currently serves as an assistant professor of nursing at Dalhousie University, Canada, where he contributes to the preparation of future nurses. He holds a PhD in nursing from the Chinese University of Hong Kong, completed a prestigious Alberta Innovate postdoctoral fellowship at the University of Alberta, Faculty of Nursing. As a productive scholar, he has authored over 60 peer-reviewed publications in reputable international journals, and his research has attracted over $420,000 in research funding. He's the founder of Nurscope Inc., a global consulting firm where he supports students, nurses, and organizations across research capacity building, digital health innovation, leadership, and career development. Dr. Akingbade's work reflects a clear vision to position nursing at the forefront of digital innovation, health equity, and transformational leadership in healthcare. If you are positive, you're going to have the best of the best in this session, I want you to please give a round of applause as we virtually welcome Dr. Oluwadamilare Akingbade. Over to you, sir.
Am I audible enough? Okay, great. All right, I'm so glad to be with you this morning here in Canada. Good afternoon, everyone. The Provost, College of Medicine, University of Ibadan, members of the college management, the grand patron of the College Research and Innovation Hub, staff advisors of the hub, the president. Can you hear me? Great. Members of the Executive Council of the hub, invited speaker and panelists, esteemed guests, and ladies and gentlemen, my dear future healthcare innovators, I'm so glad to be with us this morning or afternoon. I'm going to be sharing my screen as I make my presentation. Can you please give me the ability to share? Great, thank you. Awesome. So within the space of time, I'm going to be speaking on research-driven digital innovations, building the future of African healthcare. Research-driven digital innovations, building the future of African healthcare. I'm so glad to be here today to speak about this topic that I am very, very passionate about. And I want to congratulate you all for this conference. It's a great thing you are doing, and I really appreciate your work. Introduction. Let's ask or answer this question. What healthcare problem frustrates you the most? I want to take some time to think about what is that problem that has caught your fancy, caught your attention in the healthcare field. I tell students, researchers that I speak to that as far as the healthcare field is concerned, there must be something that catches your attention. One of the things I wished I knew when I was a student is to have picked that area of interest very early. You know, during my undergraduate days, I had little exposure. Yes, I did a research study on mental health. I went to Neuropsychiatric Hospital around Abeokuta for data collection. That was my research field at that time. But then on moving to my master's, I went into another field. I did something on community tuberculosis care. And on PhD, I did something very different on oncology research and things like that. However, during PhD, I found a focus, which is what I am focusing on now. But I would like to, if there is anything I'm going to take away from this conference, think very deeply about a problem you are going to solve in healthcare. And I tell you, as I tell everybody I meet, challenging to be great researchers, there is a problem you can solve in healthcare. As vast, as wide as healthcare is, there is something that you are meant to solve as a problem in this field. The system is under pressure. We have more patients, we have fewer workers, we have the Japa syndrome, many nurses, doctors relocating in droves abroad, looking for greener pastures and things like that. We have rising chronic disease, mental health crisis, limited resources, growing costs, and access inequity. And we cannot solve today's problems with yesterday's solutions. I'm not sure whether it was the provost when he was giving his goodwill message, talking about the place of research and mentioning how we must evolve. Healthcare is becoming more sophisticated. Things are changing every day. The dynamics are changing, and we must be abreast of these changes in technology, and we must be prepared to solve these problems. Imagine an Africa where everyone accesses healthcare regardless of location, where AI helps clinicians make faster, better decisions, where data drives health policy and resource allocation, where patients receive timely, personalized care, and where innovation is built within Africa and for Africa. Now, I've seen a lot of innovators rise from various countries, building a lot of things with funding from the government. Currently in Canada, the government of Canada released a very large, large fund for researchers who are working on artificial intelligence. And we see many of these innovations, right, in developed countries, in high income countries and things like that. And then the question is, the realities in Africa are very, very different. We need researchers on the ground of the African soil that will arise to solve the problem in healthcare, build innovations within Africa and for Africa. And let me speak briefly about research. I won't take my time on this because I know you are passionate about research. That's why you are here, just to remind us some points about research. And it's important for us to note that technology is not equal to innovation. There is a very marked difference between technology and innovation. So we have many innovators rising, people building various tech days, as we call them in Nigeria, tech bro, tech Cs. Everybody wants to do something tech, right? But there is the innovation piece, that it is research that helps to solve that piece, right? As we are building technological innovations, we must make sure that we are bringing research into it. And as we know, is the era of evidence-based practice, evidence-based medicine, evidence-based nursing. We need to base our innovations on evidence. And this presentation, I'll be talking about some areas where we can do a lot of work as far as, bringing technology and bringing research to drive innovations. Every innovation began with a question. Why is this happening? Can we do this better? What if we tried? Right. And I mentioned earlier that we need to start asking questions as you are on your clinical practice, going through your education, start asking questions. And one important thing, when I started this presentation, I mentioned that we need to, at this early time, develop an area of focus. Now, when you are going to become maybe a professor in the nearest future, you are going to become a professor of something. You are going to become an authority as far as a field is concerned. So at this very early stage, you need to pick that research area and be hammering it for the next 30 years, hammering it for the next 40 years. Before you know it, you are going to become an authority as far as that field is concerned. So what is research? It is a systematic process of asking important questions and generating evidence to improve lives. It's not just writing papers, but solving problems. Why does research matter? It matters because it helps understand root causes of disease, identify risk factors and populations, test and evaluate interventions, inform national health policies, improve healthcare delivery, and drive scientific breakthroughs. How it started, I had my first degree in nursing from Lautech, Ogbomoso in the year 2011. And I moved to the University of Ibadan in the year 2015 for my master's. I completed it 2016, 2017. And there is no way I'm going to talk about my research journey without mentioning the big role of research. I teach in Canada and I teach in Nigeria virtually. I teach some students at Chrysler University and Howard University. And just some days ago, I was taking them research and I'm still going to take them some hours time, right? And then I was talking about when I did my master's at the University of Ibadan. That all that you are currently is one of the halls where we have our lectures, when we are doing our statistics class, our research class, we are taught by professionals from Faculty of Public Health and things like that. And Ibadan was that place I built, that vision for research came very strongly to me. At Ibadan, I met various researchers, in nursing, outside nursing, doing very great. They've gone around the whole world doing research, and I caught that vision at the University of Ibadan, and the rest, as they say, is history. And after that, I moved to Hong Kong for my PhD, as you had, and then I went to the University of Alberta here in Canada for my postdoctoral fellowship funded by Alberta. Thank you so much, media. Thank you. Thanks for this great talk. It's not easy to connect two words together in quotes. Right. So I was funded by Alberta Innovates postdoctoral fellowship for my PhD. And after maybe some months to defending my final thesis, I was looking for an opportunity to do a postdoctoral fellowship. And then I found that organization called Alberta Innovates. I'm so glad that in this conference, there is going to be a part where we're going to be speaking about getting funding for our research and things like that. If I can turn back the hands of time, one of the things I wish I was exposed to earlier than now, and I'm doing my best to expose nursing students, healthcare professionals that come across with, to expose them early to is that area of funding. I noticed that we are trying in Africa and Nigeria, we have been trying so much in building research competence, but we need to try more. We need to pay more attention to training healthcare professionals on getting grants, writing, securing grants for our innovations, for our projects, and various things like that. Okay, and during my PhD focused on developing a mobile application to provide psychoeducational support for Nigerian women with breast cancer receiving chemotherapy. And then that project was also funded by the university. It was funded by the Oncology Nursing Foundation and various funding bodies. One thing I'm going to encourage you, when you pick an area of research, that's what you are going to be focusing on, it's very important for you to begin to note the funders in that particular area. And one thing I always tell people is that you can innovate from where you are. If there is any lesson I've learned over the years is don't wait. Do not wait. Start from where you are and start innovating. It was when I was on the soil of Ibadan that I found a problem. When I entered master's program at UI, I was struggling with some part of research. I told you I was exposed to it not early like that, like you are. So then getting to UI, and I was just being bamboozled by a lot of stuff. People who did their first degree in UI came with a lot of hyper stuff and just challenging. And then I'm like, where will I even start from? And then I started, reading, apply myself to it and various things like that. And eventually I mastered it. And then I made up my mind that I'm going to build an institute, right, that we are going to be training nurses in research. And I know some of you would have heard of the Institute of Nursing Research. That was an innovation that I built when I was in Ibadan, actually. I found a problem that nurses are struggling with research, and I wanted to nip that problem in the bud. And the rest, as they say, is history. We have been able to do various things. Many of the researchers we have built through that medium have done greatly in research in Nigeria, gone across Africa, across various countries in the world on the wings of research. So during my PhD, I said it was about developing a mobile application, and that was the ChemoNurse breast cancer application, which was developed to provide psychological support for women with breast cancer receiving chemotherapy. That application had various components like breast cancer education, coping skills training. I found in that project that many women with breast cancer have a lot of psychological issues. While we are helping them with chemotherapy, helping them with various things, we are not paying very good attention to their psychological health. And that's where I, found that passion for mental health, which I'm still researching on till date. So we developed the application, and it was a very big success. I published, findings from that, research in various journals. When the moderator was asking questions, she asked some of the questions, some of the side designs I used in my PhD work was part of those questions she raised. I did a systematic review and meta-analysis on the effect of MLT interventions on psychological issues experienced by women undergoing chemotherapy for breast cancer. I did a focus group study, a qualitative study, trying to understand what is the perceived feasibility and usefulness of these interventions. And then we developed mobile application, and then we tested it using a pilot randomized control trial and then a main randomized control trial, which has been published in various journals. Okay, and currently my work is at the intersection of mental health and digital health. I currently have a position at School of Nursing here in Canada, as rightly said, and I've been able to also build a firm, a consulting firm. Like you had, I'm also a global nurse consultant. I have a consultancy that caters to research, caters to innovation, and through this platform, I do a lot of work in mentoring nurses, when we get grants, in administering the grants, supporting organizations, governmental establishments who are trying to, do one project or the other. One typical one that came to me recently was one project that we are currently doing, just finished actually. It's at the Yukon government. It's a northern area in Canada. They have climate issues and things like that, and we're able to support that particular project. And this vision for what I do now, was birthed many, many years ago. So one thing that is very important about birthing the vision early is when you get it right. I say that a lot, get it right and then get better. This season of your life is that period to get it right in research. If you can just get it right, you just continue to build on what you have built. Okay, so as far as my research journey is concerned, I mentioned, I work on breast cancer research, digital health, mental health, AI, education, innovations, digital innovations, various, innovative platforms which have been developed to support various healthcare issues. Using AI, using mobile applications, telehealth, wearable devices, electronic health records, health chatbots, and so on. And I'm going to be mentioning some of them as we move on. So we start from identifying the problem, the challenge, and then you bring the research evidence. And that was the trajectory I followed during my PhD. And one important, interesting thing, I see a lot, I give kudos to researchers on the African soil. It's not easy, actually. It's not easy to research on the African. So let's put our hands together for ourselves. Currently, researchers, doctors, nurses, medical lab scientists, pharmacists who are in Nigeria and are conducting research. I know during my master's, one of the first things I bought was a generator because there was no light, and then it was ash, little funding for research. The computer I was using that time was very, very bad, it was like a desktop, and things like that was very hard, and I can't even really, that was, 2016, going to 10 years now. And I can't imagine how the economy is now. And still, people are forging and doing a lot of work and still putting things together. And that's one of the reasons why, if any Nigerian has the opportunity to just travel out, you see them doing very, very great things because they have learned how to thrive in adversity. And I tell you, now is the time to thrive. Don't wait until you wait. Okay, when I get abroad, I will start doing great things. No, one thing about darkness or about challenges is that light actually shines out of darkness. There are various areas currently in Canada that are already lighted with innovations, lighted with breakthroughs. And then, of course, we bring light to the environment, to the community as we try to look for more problems to solve. But Africa is that place that is very easy to shine your light. Oh, there are many problems confronting healthcare. There are many problems that need solution. And the solutions to those problems are not far away. You are not going to start solving those problems when you become a professor of medicine, when you become a professor of nursing, a professor of physiotherapy. No, the time to start solving that problem is now. And I started solving those problems I found in nursing from as a master's student. Oh, I was met with many critics. But what does he know? What does he think he is? Where is it coming from? How many researchers has it done? How many projects has it conducted? And things like that. Where is it coming from to come and start things like this and stuff like that? Don't worry. Don't worry. People can rise up and say a lot of things against you, but when you know that this is what I want to achieve and you can stay at it, you are going to get the results. Right. So some data innovations that I'm going to be mentioning, we have a couple of them. We have wearable devices, and I see that a lot. It's also coming, on the African soil, whereby we have people wearing Apple Watches, installing various applications on their mobile devices. And then as healthcare professionals, we can get real-time access to some of this data as the patients wear these devices. We also have medication reminders, we have telemedicine, we have telenursing. We have points of care documentation. I know we're having that in many, hospitals now in Nigeria. Before I left in 2020, we didn't have really much like that, but I think it's, coming up now, electronic health records and things like that. And we are coming into the world of robotics, that a physician, a surgeon can be abroad, and be conducting surgery, in a particular, remote area, with the help of robotics, with the help of technology and various things like that. We also, as an educator, I train nursing students. Oh, in Canada, yeah, we have the technology has really advanced. In Nigeria, those days, I remember we used to have Miss Jones, as we call, the mannequin. Those mannequins look like the ones that they use in boutiques, but yeah, technology has actually advanced so far, into, having high fidelity mannequins that can actually mimic various conditions. Those mannequins can check their pulse, check their blood pressure. They can mimic postpartum hemorrhage and various stuff like that. Through simulation, we can train our nursing students, medical students. We don't need, to get them to the hospital environment to, be handling patients before they are trained, using these skills. We also have virtual reality. Virtual reality, you can put that device on and you are going to be in that particular world as it were. And then you can use that to also learn various skills. We have virtual reality, we have the augmented reality. And we also have artificial intelligence. Excuse me. I mentioned earlier on how the government of Canada, and not only Canada actually, many governments of the world are now doing a lot of work as far as artificial intelligence is concerned. I know some scholars, some doctors, some nurses are still very, very, scared or very, not sure if they want to use AI very well, not sure how, if they want to accept it. But I tell you, I kid you not, as they say, AI has come to stay. It has come to stay in healthcare. It has come to stay in research. And the onus lies on us to start learning these tools. And one thing that, it gives me concern about, all these innovations is that if you're not careful, you are going to find it very difficult to catch up with these innovations because they are changing by the day. As you are still trying to learn one, it has been updated to another one. So the onus lies, the earlier you start, the better. The best time to have started was yesterday, actually. And the next best time to start, learning these tools is today. And one thing, I love this environment. When I got this invitation, I was like, wow, okay, you are inviting me to come and speak in this platform, bringing various healthcare professionals together. One thing I've discovered as far as the healthcare system is concerned is that the silos are breaking down internationally. And we must be very intentional about breaking down the professional silos in Nigeria and on the African, excuse me, and on the African continent. We must be very passionate about, breaking down these silos. The era has gone. The era of doctors doing their own stuff. I think the provost or the advisor or the patron of this organization mentioned that earlier on, that we should bring other, professionals to come and join, the field and what we are doing here. It's very important that we can build skills of interprofessional collaboration. AI in Canada, when you are applying for a grant, one of the things that will help you to win that grant is when you have various professionals on that grant. Excuse me, when you have various professionals that you have brought on board on that grant. I know a nursing professor here in Canada who has a medical doctor on our team. She has, somebody in communications from our team. She has psychologists on our team. All of us bring our individual professional lenses. There is a way a doctor is going to see an issue that a nurse will not see it. There is a way a nurse is going to see an issue because of the place he or she works with the patient 24 hours, always on the ward. There is a lens from which that nurse is going to see an issue that the doctor is not going to see it. There is a way a pharmacist will see an issue. There is a way a pharmacologist, there is a way a social worker, there is a way a psychologist is going to see an issue. So the era has gone. That nurses will want to do their thing, doctors will want to do their thing, all of us doing things independently, and the patient gets to suffer. The time has come for us to unite, for us to come together, software developers, researchers, engineers, even patients. One of the things I'm going to see in my presentation during my PhD work is that I built that innovation with patients. One of the reasons where some healthcare interventions are not going to go far is because those innovations were built without patient considerations. Patients do not have a say. As far as those innovations is concerned, we need all hands to be on deck to work as a team to build these innovations. Now it's your turn. I'm rounding up. Now it is your turn. You've had various things I've said. Now it is your turn. I wish if wishes were horses, as they say, beggars will ride. We are so privileged. During my PhD from 2020 to 2023, there was no AI. The only AI tool, anything that looked like AI at that time, where there was AI, but in Hong Kong, we didn't have access to it. At that time, the government of Hong Kong blocked ChatGPT. They were still not sure whether they want, I'm not sure if they've changed now, but they blocked access to ChatGPT in Hong Kong at that time. The only one we had access to, I think, was Grammarly and Quillbot, just so you check the grammar and other things like that. But now, Now, there are a lot of tools that can make your research go very, very fast, that can make your innovation move very, very fast. And it is time for us to leverage these tools. It's a very interesting time to be alive. It's interesting time for us to begin to, leverage these innovations. You can start today. Somebody's going to be asking me, where do I start from? Start from where you are. Join a research group or lab. Volunteer on active projects. Volunteering is very important. One of the things that volunteering is going to do for you is it's going to bring you into rooms that you did not know you can access. I told you when I was at the University of Ibadan, during my master's, I got the opportunity to volunteer for one of our professors, Professor Priska Adejimo, and I've been volunteering for her till date. I'm still working very, very closely with her. She's going to be launching a book very soon, Being a Dean. She's the current dean of the Faculty of Nursing University of Ibadan, and I'm on our team trying to work together on how to publish that book and launch that book coming up in the next couple of weeks, written with deans from various faculties, colleges from the University of Ibadan. Right, volunteering. And through my volunteering with her, she was able to bring me into rooms. She was the one that recommended me to work at the Nursing and Midwifery Council of Nigeria in Abuja, between the year 2017 and 2020, before I traveled out for my PhD. You have many professors that are professors of medicine, on grant in UCH, in UI, doing very, very great things. And then you are wondering, this professor is too busy. This professor is too busy. Even the rich struggle, even the busy professors struggle. When you get to a point in your career, there are some things you can't do again. There are some things that become very difficult, very challenging for you to do. You need hands to do them. You cannot expect the professor of medicine at that level to now start trying to do a systematic review, and they are too busy for that. So they need postdoctoral fellows, they need PhD students, master's students, undergraduate students who are going to be working with them. And that's why, research actually thrives a lot, in this part of the world, because we have a lot of capacity. In a typical faculty, you're going to have a lot of research staff. It was when I got here that I see in the Faculty of Nursing, for example, we can have a staff of 250 or 300. In Hong Kong, many people in different, especially in that Hong Kong, many PhD students with their offices, research assistants in their categories, research associates, postdoctoral fellows, and then the professors, big facilities. And they are getting the results. Now, that school I did my PhD in Hong Kong is the sixth now in the world, the sixth nursing institution in the world. Even ahead of many institutions in Canada currently where I am. Those Chinese are doing a lot of work, working very hard, to build these innovations. So how can you get this, into these rooms is by volunteering, looking for a need in that professor's life that you can solve. They are going to present. They are very busy. They need somebody to prepare their PowerPoint. Build yourself to a level of competence that professor can give you the PowerPoint to go and prepare. And then we don't need to revise it because you can sense his art. You know what he's going to talk about. You know how he's going to say it. You have gone for the best tools to give a very killing presentation. That professor will always have you by their side. Anywhere they are going, they will not want to lose that very good, and so volunteer. Attend scientific conferences, very, very important. I'm really congratulating you today for making this opportunity to be here to attend this very important conference. This is how it starts, but don't let it stop here. From where you are, you can get grants that will help you, go outside the country, to present. I've seen undergraduates do that, medicine, nursing, and various professions do that, go to various African countries to present. Currently, some of my mentees, in Lagos are currently in Abuja at the Digital Health Conference, presenting, some of the studies that we conducted at Nursescope Incorporated. Read and publish papers. Yes, we are part of journal club, but I've noticed the Pareto principle working so much as far as journal clubs and any team is concerned. In any team, it's just 20% of the people doing 80% of the work. So other people are just, supporting, and not really managing the process. If any paper comes out today and we have many names on that paper, chances are that just one or two people that are going to, do all the work. Don't just let them to put in your name in manuscript. You must do the work. And if you're on a team, you are not productive, you are not doing the work, they won't invite you next time because they know that you are not a productive person. Learn AI, data science, study statistics and research methods. Oh, I can't that place of studying this cannot be overemphasized. I made up my mind during my master's, during my PhD, that I was going to really learn it. I was really going to know it. So I had textbooks, nursing research textbooks, health research textbooks, statistics. I studied them from pali to pali, mastering them, watching videos, building my capacity that I will be able to present my research in any room in the world, and they're going to stand and note that somebody is actually speaking. He knows his onions, he knows his stuff as far as research is concerned. Build your programming skills, collaborate across disciplines, and stay curious. 5 habits of great innovators: they stay curious, they read daily, they build relationships, they keep learning, and they focus on impact. The only way to discover the limits of the possible is to go beyond them into the impossible. And I'm speaking to you this morning. It's time for you to go beyond the possible into the impossible. We have stayed so much in the confines of the possible. Time is now to move into the impossible. And of course, you need to say yes to yourself. The top of one mountain is always the bottom of another. However, when you get to the top of that mountain, you must raise the top and climb some more. The future belongs to problem solvers. Don't wait for graduation. Don't wait for permission. Start solving today. Thank you so much for listening. And I hope you have questions, and I'm very happy to answer them. Yeah.
Thank you very much, Dr. Akingbade, sir. Now we'll be taking a few questions. If you have a question, I'd like to ask that you please just step forward so that it's easier to coordinate. Could you just step forward this way? So if you have a question, just quickly step forward. And then I'm aware that we have a few questions online. Can I have an usher, please, to help me with the mic? Can I have one of the ushers for the event to help me with the mic, please? Okay, so I'm going to ask one final time. If you have a question, please just come forward so I know everybody who is taking questions. Do we have any questions online? Are there any questions online? None. Okay, so I think we have just one question. Please get a second mic for him. So we just want to know your name, your school, what organization you're joining us from, and then your question.
All right. Thank you very much, sir, for that wonderful presentation. So my question is, you mentioned that about funding. For medical students, most of these funding opportunities coming by them as medical students is something that has not been so easy. And you mentioned that for students, for people who have actually found a niche where they want to do their research, they should look for funding of that area. So I want to ask, what are some of the funding opportunities you think we are going to suggest students to look into? I'm aware of RSTMH, but there's a little glitch there because, for instance, someone who is interested in neuroscience, RSTMH grants for medical students largely sponsors tropical disease research and infectious diseases. So it makes it a bit challenging for people who are going into, let's say, cardiology research proper or neuroscience, to, especially as medical students, to fit in this funding opportunity. So how do you think as students we can surpass this funding barrier to actually carry out quality research and also to list some important opportunities? Thank you.
Okay, great question. I can relate perfectly with that challenge. I have experienced it too firsthand, and I agree with your position. However, one thing that has helped me over time in funding is When you have picked a particular area that this is your niche or your research interest, the next thing you need to do is look out for those who are being funded in that field, right? And you can look globally, look also in Africa, look for a mentor as far as that field is concerned. And when you join these mentors, when you connect with them, one thing that they are going to do for you is they are going to they understand the I'm hearing a sound. So they understand the funding dynamics, they understand the organizations, the associations that you need to join. One thing that can help you when you have picked an area is to look out for the associations in that particular area, right? So what are the associations in that field, in that niche that you need to join? When you join those associations, we are going to see the funding opportunities that are available within those associations. And then many of those funding, they have actually broken them down into specifics. For example, they have many organizations, many associations, have funding for maybe early career researchers, for students, PhD scholars, postdoctoral fellows, and things like that. And one thing that I always encourage young ones to, do is start from the little grants. Even as small as $1,000, as little as £5,000 is, you can start from that, or as small as even a conference grant. Some of my mentees got some of these conference grants recently to travel to Canada, for an oncology nursing conference, right? So just look for that particular niche that you have, and then look for the mentors in that area and connect with them. Check their CVs. They are going to, you see the funding journey. And one of the things you should note about this funding is that they're always in cycles. Always in cycles. If you see that somebody has gotten this particular fund this year, have a funding calendar. I encourage people to have that a lot. Have a funding calendar. Note those funds that are available currently that people are getting this year, and then start preparing for them against next year. One of the mistakes that we make in preparing for funding is that we start when it's 2 weeks. Thank God for ChatGPT. We just use AI to just no. We don't rush funding like that. We need to prepare for funding systematically. Have that funding calendar and then preparing for them. Another thing that is going to help you is LinkedIn. I know many of us use LinkedIn and some of us use it sparingly. I got serious. I've been on it since like maybe 2011 or thereabouts, but I got serious with it during my PhD too. Please get very, very serious with LinkedIn. Something about following people, that are getting funding is that they are going to be reposting. They're going to be resharing. Even if they will not repost, they will just like. When you follow somebody on LinkedIn, the person likes a post, right? You are going to see that post as a follower of that person. And not only that, because the algorithm on LinkedIn has noticed that this person is not politics that this person likes. This person likes opportunities. And then it keeps, sharing those opportunities. And of course, there are various platforms, that you can also get. And one thing I'm going to round up with is you can be the first to get some particular funding opportunities. We are not searching. I put it to us, as Rufai was saying of Arise News TV, we say, I put it to you that we have not been searching, myself inclusive. We need to search more. During my PhD was that time I decided I'm going to really, really search. There was one day I went to the office and I told myself the only thing I'm doing in the office today is searching for opportunities. And I got everyone who finds, we actually see. You will see if you look for it. So sit down and then you can use AI tools. You can use AI to look for opportunities. You can start from Google and through all these opportunities that you find, this one will connect you with this and things like that. I know it's a very long journey, but the earlier you start, the better, and you're going to gain competence in it. Thank you.
Everybody, that's the only question, and I'd like us to give a rousing ovation once again. Thank you so much. That was such an interesting and enlightening session. Thank you so much. We would like to say thank you on behalf of the third annual scientific conference of CRIH. We'd like to say thank you for joining us. Thank you for gracing the occasion and honoring our invitation. Thank you so much.